When I have a patient who comes to me with depression, the way that I treat is to first take their complete health history, which involves an hour to an hour and a half. I'm discussing with them where they've been, where they've come from, going all the way back to early childhood memories, as far back as they can go. The unique thing about this approach is I'm not dividing the emotional, psychological, intellectual, and physical. I'm getting their history on all levels. So any physical problems they've had related to depression or just related not to depression, just their overall health history. What I'm also doing is finding out their history in terms of which medical doctors from the straight medical establishment they've seen. I want to know if they've been on any medications, what their formal diagnosis is, if there's been any blood tests, hair analysis, any type of testing at all. I want to see all of that as well. So it's a pretty comprehensive intake to get a very complete idea of who this person is as an emotional, spiritual, intellectual, and physical being.
And then where would you go from there treating them?
Okay, then I'll do my own diagnosis and my own workup. And that will involve, since I'm an OMD, Doctor of Oriental Medicine, and homeopath, that will involve their pulse diagnosis, according to Chinese medical principles, diagnosis from a homeopathic point of view, and a tongue diagnosis as well. We'll analyze the tongue and see exactly which organs are diseased and have pathology. What it involve mostly is finding out when the depression, exactly what their symptoms are of the depression. It's so different for every person. Some people have trouble getting to sleep at night, so that would be a symptom. Some people, you might be able to find that it's centered on the loss of a loved one, either a relationship, a maid, a parent, a pet, some grief incident. It could be, there's always some emotional onset that you can track back, and that'll help me to determine which homeopathic remedy will apply to them. Now, on a deeper level than that, I'm also going to track back to the childhood and find out what the basic family scenario was growing up. Not that there's necessarily pathology there, but based on the dynamic, the personality dynamics between the parents, the siblings, and the person with the depression, it will point me to which homeopathic remedy I'm going to want to use, will be successful in treating.
If someone came to you and they were having extreme sleeplessness, loss of appetite, how would you treat them?
Well, I'm always going to ask the person which holistic modalities they're interested in. If they have no opinion and a person, let's say, has extreme sleeplessness or loss of appetite, let's say, what I would do is first say, are you interested in homeopathic medicine? So if a person had extreme sleeplessness and loss of appetite, which are pretty typical symptoms when someone is depressed, I'll ask them, are they interested in getting treated using homeopathy, herbs, nutrition, or possibly Oriental medicine, Chinese herbs, or acupuncture? So let's say someone was open to whichever modalities I do. What my preference is to use classical homeopathic medicine. So I'll pick a homeopathic remedy that will perfectly match their symptoms. There might be 20 or 30 remedies for sleeplessness and loss of appetite, and I'm going to figure out, based on the peculiar things going on with this one individual, which remedy will work. For example, just as an example, if someone couldn't sleep and their mind was very, very overactive, it just kept thinking and thinking and thinking and thinking, I might give them a homeopathic remedy that is made out of coffee that we drink. And the reason for that is that if you drink coffee, you will get extreme sleeplessness and an overactive mind. So we use homeopathic coffee to cure that particular mind state.
Okay.
So the principle upon which homeopathy is based, or the way in which homeopathy works, is called the law of the similars, which means we give a homeopathic remedy that is similar to the disease state or the symptoms state of the person. So for instance, with a person who has an overactive mind, when they can't get to sleep, we're going to give them homeopathic coffee. Now, nobody knows on a scientific level exactly why it works, but we think, based on the research that everybody's doing right now, that it's based on resonance. What I mean by resonance is that everything in the universe has a vibrational frequency or a resonating frequency. It's what makes everything unique. A table is hard, but it's also alive in a certain sense, in that the molecules are vibrating at a certain frequency, which makes it maple or oak or eucalyptus or whatever that hardwood is. And with a human being, we each also have vibrational frequencies. And what we're doing is matching the frequency of the person to the frequency of the remedy. For example, if a jet plane were flying overhead at a certain frequency, the glasses on your shelves at home would start to vibrate. Or if you took a pitchfork and rang it on one end of the room and had a similar pitchfork on the other end of the room, the other pitchfork would start to vibrate. So we pick a homeopathic remedy with a similar frequency, and it hits the frequency of the person, thereby changing that person's frequency, thereby changing their symptoms and ridding them of their disease. And that's how the cure actually takes place. The way in which we know which remedy to use or which frequency it vibrates on is we give healthy people the remedies, the homeopathic medications, and in healthy people the medications cause the symptoms that we will use them for in the people with the disease states or the symptoms. So if we were to give someone, let's say we were cutting up an onion for dinner and we got tearing eyes and a runny nose, then we know that that remedy in a homeopathic form, homeopathic onion, or Allium cepa as it's called, the botanical name, will cure a cold when a person has a runny nose and tearing eyes and a headache. Or homeopathic arsenic, for instance, will be used for diarrhea or food poisoning, because if you were to give someone arsenic in a crude form, it would cause diarrhea, food poisoning, and vomiting. Mm-hmm. The difference between what I would do as a homeopath and the traditional allopathic or Western medical approach is that my approach will actually cure or regulate the brain chemistry and the body chemistry of the person so that they won't be dependent on a drug for the rest of their lives. When we hit upon the correct homeopathic remedy, the person's physiology, the actual chemistry in the body, will change, and their symptoms of depression will actually be alleviated, and at some point they'll diminish, and actually go away, so that we're healing the person rather than just taking the symptoms away. In Western medicine, when we use a medication to take the symptoms away, whether we understand it or not in the present time, there's always some type of side effect that occurs somewhere else. Most medical doctors will acknowledge that maybe the sex drive or the appetite might change, but what causes those changes are the effect on the liver or the kidneys and the organs. And later on in life there'll be degenerative diseases from the toxicity, because the body has a hard time metabolizing and getting rid of these crude drug medications that are used in Western medicine. Now, I might also at times recommend that a person go to a psychiatrist and be put on medications. I'm not at all against that. In fact, quite a few of my patients who I treat homeopathically are simultaneously on some form of antidepressants, either Prozac or lithium. So it's not that homeopathy and antidepressants don't work together. They do. It's just that the goal at some point, even with those patients, is to get them to a healthy enough state using homeopathy that we can actually get them off the antidepressant too. So I'm taking each patient as an individual. Nobody who comes in do I tell, this is the way you have to do it. You have to go off your antidepressant drug, which a lot of homeopaths would. They wouldn't treat them unless they go off it. But I feel like we have to work as a team, and some people need them to get through particularly difficult times, and then they can go off them. Some people don't need them at all. They just weren't aware that there was any other alternative. So that's part of the intake and history. I try to figure out what exactly this person needs.
cut for a second?